Hi, I'm Farah, Director and Founder of UPress, and this is our community research project called Design Community, looking at safest places across East London. And this short documentary film will be looking at how we've conducted this research, as well as hearing some of the stories coming up as well. So, see you in a bit.
HealTogether CIC is really important for us to sort of sometimes reflect of where we started. The beginning of HealTogether was actually sort of understanding the need of the community, and that need we could no longer ignore.
A safe and a welcoming community space is somewhere where you feel heard, seen, and not only representing yourself, but the community that you're in. Before I was connected to HealTogether, it definitely felt like you're on your own in the community that you're in. But when I was connected through the community itself that I'm living in, it was actually pretty simple. I came in, I connected with Anab first, and then Ayan, and then the rest of the group, and then it literally was just like a domino effect.
Before HealTogether, I didn't have like an emotionally focused healing spaces where I learned to process the emotions properly in my family, in the Somali community. Sometimes even in uni, I used to just shut myself out. I had to do the work inside in order for my voice to come out, and return to therapy, and I began praying for safe healing spaces for women, and then that's how HealTogether came about 2 to 3 years ago. And being part of HealTogether feels like an accepted dua.
Safe spaces where you feel included, you feel your physical, emotional needs are met, where you can feel safe away from home, where you feel recognized, celebrated, without stigma of your culture, of your disability, of your family circumstances, the trauma, refuge, regardless which vulnerable category you fall under, you have a safe access. So I feel design community is helping me understand how centre of development can connect and explore ways we can work together to create that space.
What we picked up is, by doing that, by identifying the two barriers when it comes to Somali and the disabled community, we wanted to partner up with CDD, Centre of Development, HealTogether. And what we did is we did 3 consultations, 2 qualitative and quantitative workshops, consulted over 100 community members that included mothers, young kids that come from Somali background, and also have family members with disability and learning barriers. We really wanted to understand how the community feels about safety, inclusion, and what it means to be included. And if we were to create a safe space, what could that look like if we were to co-design it with them?
So we chose UPress through the express your interest stage because there was a clear commitment to listening to the young people that we're working with and to engaging with them beyond sort of the standard sort of KPIs that get set for projects, so moving beyond those approaches.
I really think it's just the passion and also the kind of insight and access you have to the community. So I think that's one thing that's stood out. I think also when you talked about that systemic exclusion, and so I think that was a really engaging part of why we just decided to have further discussions with you.
What we would say to the funder or the donor is that this is necessary, urgent, and it should be free and open, accessible to everyone. And I guess it kind of links to, if you look at the environment now, what are young people doing? Where can they go? Where are the spaces that they can go? Everything kind of costs money.
1, 2, 3.
We need it ASAP. It's accessible, urgent, and free.
So we worked together for many years, working with Somali community and with the whole community of Tower Hamlets. I think there's a lot of barriers in the statutory services. I think people's needs are not catered for in many ways. But I think there's an incredible voluntary sector. There are loads of great Somali organisations that are really vibrant, that really are grassroots and kind of listen to the needs of the community. I think HealTogether is one of those, and I think they take a really holistic approach. So there's a lot of connection between physical, mental health, culture, spirituality, connecting people to their heritage, to having pride in the community. So yeah, those are some of the things that I've noticed.
I have a big vision and a big dream for the next 2 years. And in terms of what we want to achieve in terms of social impact, community impact, sustainability and growth, and more importantly, effective and collaborative partnerships is what I'm working towards. And I'm really excited because part of this is basically we formed a partnership with United Students to build a new building in Stratford. And that building is going to be a hub for the community, a safe space for our community to come, create and feel welcome. And we're really excited because that's the long-term impact that we're working towards, building those partnerships with ANAB, HealTogether's team, Aliyah at Centre of Development for Disabilities, as well as our local partners and young people. I'm really excited because this is the first time that we've got a big goal that we're working towards, and it has a real legacy opportunity to create that long-term legacy. So I'm really excited, and this research has been really insightful because it just showed us that, you know, one thing that kept coming up, the community kept saying to us is like, where's our hub, where's our home, where's our safe space for us to be ourselves? And from what I've seen from ANAB's workshops and the amazing work that she does, from what I've learned from Aliyah and the passion that she brings and the need for our community, there is a need for safe space. So our funders, our partners, thank you for helping us to carry this research. The next step to help us to bring this vision is to support us to execute this. And our next step for 26, I'm really excited about this, is the beginning, the first thing that we're doing with our partners is to do the research, listen, but then what we're going to do is apply what we've learned from the research to make our programs, our services and our activities, including even internships, work placements, voluntary, all accessible and inclusive for the Somali community, young people, it doesn't matter, and the disabled community, all community members. And we're really excited for that impact. So I can't wait, honestly, I can't wait. As you can see, I'm a little bit losing words because that's how excited I am. But I really appreciate you taking the time to watch our documentary film. Please do follow us on social media, engage with us and get involved in our vision. And I look forward to seeing you soon. Thank you.